I'd like to introduce the notion of some research that is rather important for you to walk away with. This is very practical. In addictions treatment, people have been thought to be, for the most part, if given MMPIs, they're generally have historically been thought for about 50 years to have about a 90% rate of pathology called antisocial personality disorder.
During acute addictive process.
Well, and it's believed that that will continue because of the fact that they relapse.
Okay.
Therefore, they are continuously in a state of being antisocial.
So addicts are almost measured as antisocial in that instrument.
And so, therefore, therapy is not usually terribly helpful because antisocial personality disorder is not generally considered very treatable. Mm-hmm. And one of the pieces of information that is extremely useful is that when measured for abstinence at 90-day intervals on an MMPI, in the first 90 days, about 80 to 90% of all people measured will still show spikes in impulsivity, spikes in anger, and spikes that would indicate moral limited behavior. In other words, antisocial functioning. Done again at 6 months of abstinence, just abstinence, not necessarily good treatment, no talking therapy, just abstinence, with some supports, some kind of consistency in the environment. That number will drop to about 60% automatically.
They become less criminalized.
That suddenly their criminality starts to reduce. By the time 9 months hits, it's usually down to about 30%. So all those people that were believed to be antisocial and criminal and untreatable
under the influence
are really having long-term effects from the chemistry of the substances that they've been taking in. Getting free of that alters that personality structure in measurable ways, repeatedly again and again. And it takes about 90 days. If there's a relapse in between, it spikes right back up again. Right up, goes right back up again. Now, from 9 months to 12 months, what you end up with is you end up with 90% who are within normal limits and 10% who are antisocial.
Are the specific drugs you're talking about?
The most of that research was done with alcohol and cannabis. Right. But it also shows that where there are mixed drugs, not necessarily heroin, but mixed drugs, that pretty much is still the pattern dynamic. It's the trend. It's a very important finding, and it's something that also really needs to be paid attention to in terms of treatment. Because in the first 90 days, helping someone go through ambivalence using a therapy like motivational interviewing would be very helpful. Because you're helping people sort things out. You're allowing them to go through what is biologically natural to go through.
Push and pull.
Push and pull.
About the whole deal.
I want to hold on. I want to let go. I want to hold on.
I will use, not use. I want to respond to the coercions of treatment or not.
Okay. In the next phase, it's about learning to regulate emotions.
Amygdala.
As soon as emotions start to kick in, suddenly, and you help them to express emotion and regulate it with feedback, they have really very increased likelihoods of reduction of all those spikes that would say that they're pathologically antisocial. By the time 9 months kicks in, you're starting to look at executive functioning of the ego, where you're starting to talk about
it's up here.
Future planning.
Executive.
Future planning. As soon as that starts to take place, and you continue to help them regulate emotion, and you give them consistency, and they're doing their job in terms of being able to stay relatively clean, you're going to see tremendous improvements. So the idea that chemistry, biology, plays an important factor is extraordinarily important and recognized.
Whether or not there is an innate genetic criminality, I don't think we know. We can't honestly say that it's not. Can't say that it's not. We don't know. Okay. But the fact that nurture and experience plays a significant role in human behavior and development, I think we can pretty much say that's true. We know that as well. You know, how does that play out? I don't think we know. But definitely chemical influences are pretty powerful. I mean, we take a look at some, people who abuse methamphetamine and look at the criminality, or crack cocaine and look at the increase in criminality in such a short period of time. It's pretty kind of obvious. If you know anybody who's been exposed to that, you see pretty quickly how the empathy changes and how the impulsivity increases.